Welcome back inside the Now Morning Show. Hope you're having a great morning so far. And you learned a little bit about water conservation inside that last segment, because I think it's everybody's business at this point. We're definitely heavy into the dry season, and we see the impacts of it. We feel the impacts of it every single day. That heat has been unbearable.
Gosh, it really has. The other day, I got into my car and I saw 38 degrees Celsius.
38?
Yes.
Wow.
I was like, no.
That was in your car?
Yeah,
That temperature. I just making sure because I know it wasn't 38 outside.
No, it wasn't. It was probably like 36.
We'd have been frying.
35, 36. Yeah.
Global warming is real.
It is.
And beyond that, I think the conservation message is one that we hear all the time, and I hope that it hasn't gone flat, if you will. You know, when you hear something, if you start ignoring it, it becomes mundane. I hope that people are really trying to conserve, and I hope that they continue to walk around and tell people, hey, turn off that hose, use a bucket, and do the things, because let's be real, Trinidadians need that big sticks over them kind of mentality sometimes.
Well, if I'm not mistaken, we still have the charge available for you to get charged for using the hose during the season
the
as well.
best big stick yet. Who wants to be charged?
Nobody wants to be charged.
Definitely not.
Yeah, so
really
I mean,
have to get
we
serious
hopefully
about
that you guys can continue to pay attention to it and make sure that you do your part, because each and every one of us have a part to play. I've been seeing WASA doing the work when it comes to repairing some damaged waterways and some leaking pipes and stuff like that. Especially I've seen them a lot in the Maraval area recently, and I know they always have leaks. So I'm really grateful for the work that they've been doing, and hopefully it will have that positive impact during the dry season. But guys, there's also a medical mission and outreach to Trinidad and Tobago. They actually started in Tobago and then they're coming across to Trinidad. So the first batch is happening from May 13th to this Sunday, May 19th in Tobago, and then they come across to Trinidad. But we're actually going to get into a conversation, a little bit more information about it. I want to welcome Stephen J.H. Isaac, the president of the Trinbago Progressive Association of the USA, Inc., and Dr. Anthony Rayborn, a naturopathic doctor and pastor. Good morning to you, gentlemen.
Good morning. It's a pleasure to be here.
It's a pleasure to have you on. Let me start with you, Mr. Isaac. Can you tell us a little bit about what this medical mission and outreach is all about, what inspired it, and why is it necessary?
Okay. We have been an organization that has been providing services over the years to the people of Trinidad and Tobago in the area of health, by providing not just lectures and those sort of things, but also providing physical things like we're talking wheelchairs, walkers, hospital beds, clothes, the rest of it. And we've done that for 10 years. This year, because of the pandemic, we had to stop. But this year we have partnered with APC Community Services, which is one of my other organizations in the United States. I'm on the board of directors. And also in Tobago with Trinbago Diaspora Outreach Network, and that's the president, Andre Phillips. I happen to be the vice president, as well as the New York director and the medical director of that organization. So we're providing people with the services in a bigger way, with more people available and more equipment and items available to benefit the people of Trinidad and Tobago. Our last day was at Fairfield Complex in Scarborough, and we were able to see quite a few people. We have teams of doctors from Loma Linda University. We have dentists, eye doctors, podiatrists on board, as well as other health professionals.
Fantastic. Dr. Rayborn, can you let us know a little bit about what you guys have been seeing in Tobago so far for this week?
Good morning. Thank you for having me on. We have had quite a number of individuals coming with problems with their feet, with diabetes, with heart problems, and it's been pretty draining. I grew up in Trinidad, and to come back and see what is happening to our country, especially when the health minister has said that we are now the third fattest country in the world. And we are seeing that happening. And it's heartbreaking to me because my mom died at the age of 57 from diabetes, my elder sister at 47. And we're seeing a plethora of individuals coming with diabetes. And diabetes is not just a generational, a biological or genetical situation. It's generational. How we eat, how we cook, it's passed on. And so we've seen quite a number of that where people are no longer eating the good food we have of the land, but are changing to the American diet, getting American diseases.
That's very, very interesting because, yes, we've been hearing the Ministry of Health saying it, and to hear you reiterate the point really brings it home because now we're seeing, where we go on the ground is showing that people are suffering, people are choosing making these lifestyle choices that are not positively affecting them. So how do we begin to fix this problem, Doc? Dr. Rayborn? How do we begin to fix some of these lifestyle choices, lifestyle diseases?
Well, lifestyle diseases means we have to change our lifestyles. I appreciate, for example, the American apple is not as good as a Trinidad and Tobago guava. There are much more vitamins in a guava. And we have to learn to love what we have. As a matter of fact, the way God created fruits and vegetables, it's based on the geographical area where you live. It is good for your body. So while it might be okay to import an American apple, it's not made for our bodies here in the tropics. We have all the food that we need. It's just a matter of appreciating what we have. So in other words, our eyes are larger than our stomachs. And if we keep doing what we have done, we will keep getting what we have gotten.
And that's fair. That's a fair assessment because I often notice that when we do consume our local products, our local natural products that grows from the trees in Trinidad and Tobago, we definitely get that healthier feeling. We definitely get seasonal fruits as well that come in time for what we need it to be able to help to boost. Right. So let me jump back to you, Mr. Isaac, and ask where we're planning to go in Tobago for the rest of the week.
Okay, I'm glad you asked. Today we're heading to Roxborough, and that would be at the Old Health Center, close to the Sid Grace Stadium in Roxborough. That would be today and tomorrow, starting this morning. And we're also having another session on tomorrow. And as I'm saying that, I would also want to add that we're having a massive, I'm going to say massive because we're having the entire team who will be present in Tobago over the weekend for a big seminar at the Goodwood Secondary School, starting from just about 8, 9 o'clock in the morning, going right through the entire day.
What does this medical symposium include? He says everybody's going to be on board, but what kind of conversations are we having?
Well, we're having conversations about all the different areas of health represented by the individuals who are going to be there. So it's going to be on any area of health, if you want to say. We have cardiovascular surgeons, we have the podiatrists, we have the eye doctors and other professionals like Dr. Rayborn. We have nurses and who are in different fields. Podiatry also will be present. And I should add here that as far as that is concerned, the people of Tobago have already benefited quite a lot from 250 pairs of diabetic shoes that we got from a company in New Jersey. And they're on the ground here. Our team is here with Dr. Stephen Wells and have been doing an extremely good job. And we intend to continue along that path so that people can get the benefits that we decided to come here to do and to provide to the public in Trinidad and Tobago.
All right, Mr. Isaac, can you reiterate for me what are some of the things that would be available at Roxborough today if you have people want to head across there?
Yes. Well, it will be right across the board. We do have wheelchairs, walkers, canes, commodes, adult diapers, wipes where necessary, PPEs. We would have had all of those things available. However, I'm not sure exactly in terms of transport, since we're having some issues in that area, what items would be. But we do have shower chairs. I mean, you just name it. We have a host of things right across the board, hospital beds and all of those are things that we have in the storage. I can't say specifically the ones that are going to be available, but we do have a lot available. We did give out quite a bit yesterday, adult diapers and other things. So it's along that range of items, those items, that we would be serving or sharing what we have available.
And is it that people have to qualify to be able to access it? Is there an assessment of who needs it more than others, or is it just first come, first serve?
Okay, for example, if someone needs a wheelchair, as a matter of fact, we've had requests, specific requests for wheelchairs because of cases that are really, really serious. Now, those people, of course, would be addressed first. But outside of that, someone comes there and they not probably in that critical situation, but they do need one. We can't turn them away. We have walkers also. They might not be able to get a wheelchair, but they could have a walker with the wheels in front that will help them much better than the cane that they might be using or the crutches. So it depends on the needs of the individual. And the thing is that these items, whatever is left, we have that relationship with the Tobago Conference of Seventh-day Adventists, and I want to thank them, Sir Wilfred Devines and the team, for collaborating with the organization. I want to thank APC, my other organization, for joining as a part of the team, and Trinbago Progressive, Trinbago Diaspora Outreach Network. I'm getting tied up there with the Trinbago thing. So Trinbago Diaspora Outreach Network, my team on the ground here, Dr. Andre Phillip, has been providing transport with members of our Trinbago Diaspora team from the start of the health fairs in Tobago until we end on Sunday. And I just want to thank all these organizations, Dr. Janice McLean, the president of APC, and Dr. Andre Phillips of TDON.
Definitely. Dr. Ribon, I understand that you guys will be coming across to Trinidad after you finished in Tobago.
Yes.
Tell us a little bit about the plans when you get to Trinidad. Is it very similar? We see patients, we give out the wheelchairs, the walkers, that same sort of thing?
Yes, it'll be the same. We would be matriculating between the Port of Spain Community Hospital and USC. So we'll have teams at both locations.
Fantastic. And I also understand that it ends with another medical symposium on the 25th of May at the USC.
That is correct.
And is it going to be similar topics as to the one that's being discussed in Tobago this coming Saturday?
Yes.
All right, so fantastic. So, and if persons want to reach out and they want to be a part of the symposium, is there a cost to it for either one?
Nothing has a cost. The cost is their time to get to the location or to get the information. Some folks call online to have actually having conversations with me in the area of diabetes. So because I have been doing diabetes classes for quite a while with Dr. Janice McLean on behalf of the New York Health Department. We've been doing this for quite a few years. We do in person, we do online. We just actually graduated a class right in Tobago, a one-year class to prevent or delay type 2. But we also do type 2 diabetes reversal 7-week classes, also online. So these services are available, and people have actually been calling or even stopping by to have conversations. Like I went to the supermarket yesterday, and a gentleman engaged me because he heard about it, and we got into a conversation about diabetes. But one of the things in the diabetes class, there are people, and we would all have these kind of people who will say definitely nobody could stop them from eating what they're eating. And I drink my water. I like to drink my water however I want to drink my water, and nobody could tell me what to do. Yeah.
All right, fantastic. Well, gentlemen, let me say thank you very much for joining us this morning, and congratulations on the work that you're doing so far. I mean, I think it's very, very essential work, and I'm really, really happy to see you stepping forward and putting the community first.
Thank you, folks, for having us, and we do appreciate you. May God continue to bless you.
And to you as well.
Thank you.
Take care. Enjoy the rest of your day. Ladies and gentlemen, Stephen J.H. Isaac, President of Trinbago Progressive Association of the USA, Inc., and Dr. Anthony Rayborn, naturopathic doctor and pastor, just sharing a little bit about the 11th Medical Mission and Outreach that's ongoing right now. Today, they head to Scarborough at the Health Center, so if you are interested in checking out some of the services that they have available, and then they're coming to Trinidad next week, so you can stay tuned for that as well. It's in our morning show. When we take this break and come back, it's time for your birthdays. Stay tuned.